how can the patient and physician relationship improve beyond, telling their patients what not to do and what to do? I mean, we've seen so many anecdotal stories on just almost just clients leaving primary care offices defeated, right? So how can we or how can the physicians improve that relationship beyond just telling their patients what not to do or what to do?
It boils down to relationship. And, that's part of why I became a primary care doctor. It was very important to me to have a relationship with my patients, because until you really establish a rapport, and some of us are good at doing that even within the first few minutes of a visit or the first visit, and it takes time to warm up to other providers, but it boils down to relationship first and foremost. And then when you understand who your patient is and what is important to them, when you start talking about, what to do or what not to do in terms of lifestyle modifications, in order to improve a patient's outcome, when you make it relevant to what's going on in their life, then you can make an impact. So I don't just tell my patients, you're diabetic and you need to stop smoking cigarettes. I say, listen, as a diabetic, when you smoke cigarettes, you're more likely to have a heart attack or a stroke than if you weren't diabetic. And one thing we can change immediately is the cigarette smoking. And sometimes you have to really go hard with people and smack them over the head with reality. So I'll ask my patients crazy things like, do you have life insurance? Is it paid? What about long-term disability insurance? Because if you keep smoking these cigarettes and you have a heart attack or a stroke, if you don't, die and leave your spouse and children or family that you love, are you going to leave them prepared? Are they going to be able to cover the bills if you're gone? But if not, if you end up bedbound because of the stroke, or you can't work because of heart failure, do you have insurance to cover that? And are you willing to risk that? So I think when you give people tangible examples of what their outcomes can be and how it's going to not only impact their lives, but the people that they love, it sends a different message than you should just stop smoking because I said so. I'm not the boss of anybody. I'm here to educate and inform. Doctors are teachers. And so it's so important to not just teach our patients about what they're at risk for, but to give them tangible examples about what can happen if they don't take control of their health and well-being.
Yeah, and with all of the health disparities that we see, it proves that just telling clients don't do something is working. So obviously I'm being sarcastic. We have to try different methods, right? So anyway, before I get on my soapbox, because I'm the moderator on this call, so I will not give my opinion. But Dr. Noble, let me kick it over to you to get your feedback on that same question.
Oh, thank you. I think it's a two-way street. And as it's been alluded to before, trust kind of begins in the chair. And so really, it's a two-way street as far as the relationship that begins with a provider and a patient. From a patient standpoint, I think it's important for patients to be proactive. This is your health. And so with that being said, you have to be proactive in your own health, as well as come to the visit prepared. Be prepared to ask questions, be prepared with someone to help you as far as remembering some of the information that the provider is giving to you. And be patient, meaning that the relationship that it takes to develop and grow and cultivate with a provider can take time. And as Kenny alluded to, you see your barber, your stylist, maybe once a week or every 2 weeks or what have you. And so that relationship is built over years or over several visits. It's pretty hard to kind of get that in just one visit. So be patient while you're trying to develop that relationship with your provider. To my provider colleagues out there, to my healthcare workers, one of the advices that I have to give myself all the time is to pause, is to be patient myself, and to take time and be mindfulness, be in the present with that patient. Oftentimes we get busy trying to, think about, being behind with 5 patients, or I got to get to the OR or do this or do that. But when I'm with that patient, I myself have to think about, I got to be mindful and be in the present and take pause to actually hear what that patient is really talking. Only then can we really cultivate those relationships as providers start to pause and really listen and be present with their patient. And then when patients come prepared, proactive, and patient themselves, that's when the relationship really starts to get better and we really start to make some headway.